Choices podcast, brought to you from the Yankasa Digital Hub. My name is Yaya Sandra, and I'm your host for today. I'm also a young member with the PPAG. I have some panelists here with me, and I'd like them to introduce themselves.
Hi, my name is Archibald Adams. I'm a project steering committee member.
Hi, my name is Sandra Aka. I'm Francis Martin Mensah.
Thank you. So I have here with me Sandra. Sandra is a student at the Cape Coast School of the Deaf. And so we have our interpreter here who would also help with the sign language as well. So to start with, today's episode we are looking at a project, the RHE4M Project, a collaborative initiative between PPAG and CAMFED. And in this discussion, we are exploring the urgent need for tailored sexual and reproductive health rights education, what makes this project unique, and how partnerships can build lasting change in undeserved communities. So, Mr. Archibald, can you walk us through the RHE4M Project, what it is, and where it's being implemented, and why it is so important right now?
Right, so thank you, Yaira. The RHE4M Project is basically a collaboration between PPAG, Planned Parenthood Association of Ghana, and CAMFED Ghana to ensure that young people can get access to age-appropriate, scientifically proven, and then culturally sensitive reproductive health education. The project is being implemented in 4 districts. It's a pilot project running from April to September, with the hope that once the pilot project is over, we can scale it up to respond to the needs of young people across the country.
Thank you, Mr. Archibald. So, to Sandra, what specific challenges do girls in marginalized or hard-to-reach communities face when it comes to accessing reproductive health education and services?
In the villages, they don't get support, so she thinks PPAG and CAMFED should extend their project to that place.
So what kind of support is she talking about?
Helping the villages so that they also get this type of project, educate them.
Okay. So Mr. Archibald, you have done some research in terms of the challenges that they face. Can you share with us some of the challenges these girls face?
Right, so I think that for marginalized girls and then for girls like Sandra, they are already marginalized from society in terms of their disability. So she is hearing impaired. So what it means is that if there are no opportunities for whatever services, whatever information that is being provided tailored to her need, she's deprived in that way. Beyond that also, it means that she cannot even probably listen to audio messages if she has to access any reproductive health education. It has to be to their needs. Beyond that also, society itself is not ready or doesn't look like it's ready to provide general services. So if she should walk into any hospital or any health facility now, she will need someone who understands or is able to sign to be able to find out what her needs are and even provide her with that service. And as to whether that person even is able to get what she actually needs is also another problem. Then also, prior to this, we had a discussion and I was asking her whether she has friends who are not deaf impaired, so hearing impaired, sorry. So what it also means is that even when you look at research that has been done, young people rely on friends as source of information when it comes to their reproductive health. So this is the case that her friends are not able to communicate with her because of the disability. So that is also one challenge for her. Beyond that as well, whether she is lucky to find herself in a school, but with a girl with a hearing impairment who is not in school, it means that that person will be left out with no sort of information. She can trust the sort of information that her teacher, or her facilitators will provide her. But for other girls who don't or who are not in school, that will be a disadvantage for her as well. And then we also know the bars of social media. So if she doesn't have access to a smartphone, if she cannot afford the cost of data, it means that she'll be cut off as well. And how many of our TV stations do sign language? I think it's only GTV, and they do that only during their news. So with other programs, it means that she's cut off. So those are the challenges, and that is just for persons with that hearing impairment. But you can imagine with girls with sight impairment and other disability will have to go through to be able to catch up with the fast paced world that we find ourselves in, especially when it comes to access to information and services.
Okay. Thank you, Mr. Archibald. So, Sandra, as a peer educator under this project, under the RHE4M Project, what are some of your roles? What are some of the things that you are doing?
In the school, I teach my friends about health and reproductive education for the marginalized.
Okay, so can you give us like an example, without mentioning names of course, where maybe, or you teaching a friend something, anything at all?
Advise them on sexual reproductive system, like using contraceptives, pills, IUD, and others.
Okay, thank you, Sandra. So, Mr. Archibald, how is RHE4M helping to create safe, youth-friendly spaces where girls can learn about their bodies and their choices?
Right. So, the projects being implemented by PPAG and CAMFED is helping to create safe spaces. The project is using all available platforms and means to ensure that whether digital or off digital, you can have a place where you can have access to information, and you are guided. Young people nowadays have access to all sort of information, and with the invent of AI, we all know that AI information needs to be verified because not all information that is obtained from AI is accurate. So these safe spaces are there to ensure that these young girls can unlearn and learn the right information, because when a young person is at the point of decision making, that decision will be informed by what the person knows. So the project is ensuring that whether young people are offline or online, they can have access to the right information. And should they need any information to make any choice, we are sure that they'll go for the right one and make the right choices as well.
Okay. So how are local health facilities and stakeholders involved in making this exactly?
Yes, so we are training, under the project, we are training some health facility, we are training health professionals situated in some health facilities to ensure that when young people come there, they'll be youth-friendly. Unfortunately, over the period of time, we've had a lot of health professionals not being youth-friendly. So, for instance, if a young person walks in there to ask information or ask question, before the young person leaves the facility, that question will be out there. But we are training these professionals to health professionals to ensure that they are youth-friendly and they don't. They provide these services with some bit of youthfulness, or making sure that young people can walk to them. Because if a young person walks to you to ask for information, it doesn't mean the young person doesn't know. The young person knows, but he wants some bit of verification. So these services are being provided to ensure that they are a safe space. The young person can always walk in doubt to verify and then to also ensure that they can have these services without any judgments. And of course, we know young people are adventurous, but because we want them to be guided, that's why we are training these health professionals.
Okay. So Sandra, in educating your friends, the people, your other students, other colleagues, have there been any times where you feel like they are not listening to you, or they don't give you the avenue to speak to them? Are there any times where you feel shy?
I'm bold enough to teach them, and they also listen to what I say.
Okay. So, in any case where maybe another student is already, say, pregnant, have you been able to speak to anybody like that? Or how do you think you'd go about talking to somebody like that?
There was someone by name Naomi. She's saying by then she got pregnant before this program. So she is not in school at the moment.
Naomi is not in school.
Yes.
Okay.
I think she's given birth already.
Okay. So she's not speaking to Naomi or anything about going back to school.
She has not returned.
She has not returned.
No, he's saying she hasn't. She's not in the school, so
Okay,
she has not.
she can't. Okay, that's fine. So, Mr. Archibald, what strategies are being used to ensure services are inclusive and confidential?
Okay, so one of the things that this project is doing is working closely with the Cape Coast School of the Deaf to ensure that we can provide reliable information. Sandra is one of the peer educators that have been trained. So this is to ensure that whether the project officer is on site or not, they can have access to the information. And then also, the project is partnering PPAG because PPAG has certified clinics that provide reproductive health services. So the idea is that should any of the students need any of these services, they can be an arrangement between the Cape Coast Clinic and the school so that the services can be provided in terms of clinical based and reproductive health services. Beyond that as well, Sandra has been trained. We also have the reproductive health manual that we are using for other girls without disability to ensure that information on reproductive health services are available. Beyond that also, this podcast is also one means by which we are sharing information. Our social media handles are also being used. And then whenever we have access to young people, we speak to them about making the right choices as well.
Okay. So, Sandra, Mr. Archibald mentioned that you have been trained as a peer educator. Can you tell us your experience during the peer educators training?
They taught us HIV. They need to protect yourself. You don't go to friends, and you don't need to have a lot of partners whereby you be moving from one partner to the other.
Okay, so I'd like to know if the training was what introduced her to this education, or she already had some form of information before that.
No, it was through this training.
Okay. So, Ms. Archibald, why did CAMFED decide to partner with PPAG on this particular project?
All right, so CAMFED originally has some experience in the area of promoting girls' education. But we also know very well that the trend is changing. Beyond giving them education, you also need to be sure that they are making the right choices so that they can continue to be in the educational setup. So CAMFED undertook a research to look at what the reproductive health terrain looks like. And after that research, they thought that it would be good to do a pilot study to find out whether what the research found out is actually what it is on the ground. So PPAG came on top when it comes to implementation of reproductive health education and services. So that's where the partnership comes in, to look at to bring on board PPAG's experience and to bring on board CAMFED's experience also as well. But ultimately, it's to ensure that young girls can have access to reproductive health education, the right one, which is age appropriate, ensuring that they are not as overly exposed to reproductive health education, and also ensuring that whatever information that is given is scientifically proven. It's not about what someone says or someone thinks. It's not about your religion. It's not about myth and misconception. And then also ensuring that whatever reproductive health education that is given is culturally sensitive. We live in a culture where issues about sexuality is not spoken. We also live in a culture where people think that the more exposed a young person is, rather risky behaviors the person will be involved in. But over the period of time, research has shown that rather when you provide a young person with the right information, when he or she has to make that decision, she will make the right choice.
So, Mr. Archibald, how can partnerships like this, the RHE4M Project between PPAG and CAMFED, be scaled to benefit more districts in Ghana and beyond?
It's very important. Looking at the current donor community we find ourselves in, where donor fundings are being cut off, partnership is the way to go. It is. It's prudent that organizations that are working in the sector or that want to come into the sector need to partner. When you partner organizations like PPAG and you partner like-minded organizations, you help to cut off duplication of resources. You help to also ensure that communities or sites that have already benefited from such interventions are not overly implementing districts. So what it means is that if District A has already benefited from similar projects, you don't go back to District A. Yeah. But you can't get to know that information if you don't partner. Beyond that, also in partnership, you bring on board synergies. So the strength of organization A and the strength of organization B can together see to the successful implementation of any intervention or project. Then also in terms of partnership, you are also able to bring on board the learnings from previous projects that had been implemented. Mm-hmm. So I bring on board what I learned from implementing Project A in District A, and then you also bring on board what you learned from implementing Project B in District B. So these are some of the opportunities. And then also beyond that, in terms of experience, in terms of credibility, in terms of knowledge of the dynamics of the communities that similar projects have been implemented, can bring on board. So partnership is key and partnership is relevant. We are hopeful that this pilot project will bring onto board a lot of benefits, and then hopefully these two organizations, PPAG and CAMFED Ghana, can look at sourcing funding to scale up this project to reach out to all the districts and all the regions in Ghana.
Thank you. Sandra, how is this project personally helping you as a young person or as a PWD, as a person living with disability?
It helps me to help others, to teach them as to what they have to do, to help them in their education and take good decisions. As a young person, you need to advise and encourage others for future endeavors.
Okay, so then we can come to the conclusion that this project has empowered you to be able to empower others, especially the young girls as well?
Yes, please.
Okay. So, Mr. Archibald, has there been any challenges coming up in this project?
Well, not necessarily. We can basically talk about the bit about community entry, talk about the bit about working together and identifying common ground. So these are 13 issues that comes along with partnership. But I think the objective of the project is ongoing, and we are hopeful that we can reap off the benefits as such.
Okay. So how is this impacting young people in general?
Okay, so like I mentioned earlier on, the bit of access to information is critical in decision making, and young people, irrespective of whether it's around reproductive health or around life choices, it's key. When young people have access to the right information, you are sure that they'll make the best decision, and then the future is secured. We are looking forward to a society where we'll have less numbers of teenage pregnancy. We are looking to a society where we'll have less number of gender-based violence, sexual gender-based violence. We are looking forward to a society where young people can make the right choices around their reproductive health decisions, around general life decisions, so that our society can be in a better place in terms of choices, in terms of rights, and in terms of decisions around reproductive health as well.
Okay. So I'm not sure if you mentioned that earlier, but which districts are currently benefiting from this?
So like we mentioned, the project is being implemented in 3 districts. We have Abra, Seibu, Kwaman districts. We have Setre East district, and then we have Bole district.
Okay, thank you so much. Any final words, any final thoughts you want to share with us?
Right, so I just want to encourage every young person listening or watching this podcast to know that we have them at heart. We want them to be well informed. We want them to know that every decision they take has implications. It may just be a decision about you entering into a relationship and then engaging in a sexual activity with a girl, or a boy engaging with so a girl engaging with a boy, or a boy engaging with a girl. But want to know that these decisions have implications, not just on the two of you, but also on your families, the community, the society, and the country as well. So be informed, make the right choices, and know that the decisions you make today will impact your life and that of others around you.
Okay, thank you. Sandra, do you have any final words you want to share with us, or any other person watching or listening to you?
I'm saying CAMFED and PPAG have done well and should be encouraged to teach others and send the project to other places for a successful end.
Okay. Thank you so much, viewers and listeners. I hope you have learned a lot from our discussion today, the project's ongoing, and then how it is impacting people like Sandra and impacting people like myself. So thank you again for being with us. You can follow us on our social media platforms, our YouTube channels, our Yekasa channels as well. And if you have any questions regarding reproductive health education and sexual health, you can call Yekasa on our toll-free number 0800 20 2010, or you can send us a WhatsApp as well on 0245 118 Thank you so much for being with us. Bye.